enhance your look, enjoy your life. GeorgiaPlastic.com.
Hello everyone, thanks for joining us. We're back with our second case of the day. Earlier today we did a Brazilian butt lift, which is adding fat to the butt, and now we are removing fat from the butt.
Butt reduction.
A butt reduction.
It's a thing.
So this patient previously had a BBL and had fat transferred to their butt and hips, but it is a male patient and he received a little bit more fat than he would have liked and wants a more masculine shape and figure. So Dr. Okoro is doing some liposuction on this patient's buttocks. And he's also going to use the ThermiTight machine to help melt more fat and tighten the skin. He has some loose skin in that area, so he'll tighten the skin with that ThermiTight machine. One of your Facebook friends, Ada?
Who?
Ada? Ada.
Ada? Oh,
She
hi,
says,
Ada.
hey, Dr. Okoro, she wants the BBL. LOL.
She wants a BBL. I know. You can't have BBL. Implant. Let's be implant. That's good.
So if you're just joining us, we are doing our second case of the day. Earlier, if you scroll down, you'll see that we did a Brazilian butt lift earlier. Now in this case, this patient previously had a BBL, but it was too big and doesn't fit the appearance that he wanted. So he came to us for a butt reduction. So we are doing some lipo on the buttocks, and then we're gonna also do ThermiTight to help tighten that skin.
Thank you.
So we'll have to figure out just why.
Yeah.
It was done when it was submitted.
With the information?
Yep.
But I didn't see it on the video. Is it in there? I'll see it in the later.
It's in there.
Okay.
It's not, this one is the one we did. This one is the one that she did.
Okay. The one that, if you look at the email that you sent back, there was
This is the one that
we did, I know, but the one that was sent to her, she attached it to the email that you sent us.
Oh,
Yeah, yeah.
But that's not what I sent her. She said that's the old one.
Okay. I just want to mention the email, but
So just to repeat, if you guys are just joining us, We are currently in the process of a butt reduction.
Just refer back to the email I sent yesterday,
Yeah, the one you sent her yesterday.
and that one
Yeah,
is
so
correct.
okay.
She's got to do that.
If you look at our ThermiTight machine, you'll see that it's showing everything that's happening. And Dr. Okoro is doing some lipo on the buttocks. This is a butt reduction and a Thermi butt. So this procedure is being performed in our surgery center, a Such Surgery Center here at Georgia Plastic. And the plastic surgeon that's working is Dr. Stanley Okoro, our founder and lead surgeon. We do have two surgeons here at Georgia Plastic along with Dr. Okoro. He works with Dr. Daniel Park, who's also a very amazing plastic surgeon. We do everything here from tummy tucks to BBLs. Putting in a lot of work to suck out all of that fat. But he doesn't want to suck out all of the fat because we do want to keep at least some kind of shape, at least some kind of butt there. But this butt was just a little bit too big, particularly for a male patient. So in case you're wondering, this is a male patient. And if you're a man and you are wanting a larger butt or a larger, bottom area, it is possible for you to get a BBL. Men can have BBLs. So that's possible for you. So he's sucking out some of that hip area. Men typically don't want large hips. So he is sucking out fat from the butt. He's sucking out fat. This is a butt reduction. Yeah, we can take care of you. We can get you a flat stomach. We can help you in that area. You can do some liposuction on your abdomen and then take off the excess skin with the tummy tuck. Maybe a mini tuck, a standard tummy tuck, a fleur-de-lis, depending on what you need. We got you. Hello, thanks for joining us. Our staff is crazy wonderful, if that's what you mean. We have an amazing staff here. Whenever you're having your surgery at Georgia Plastic, you get an extremely qualified plastic surgeon, anesthesiologist, 2 nurses, 2 surgical techs. You get everything that you need to ensure that you have a wonderful, safe procedure. Please let us know if you have any questions or comments or anything. We'd be glad to answer the questions for you. Well, no, so for the first part of your question, if you're trying to get a Brazilian butt lift, which is not what we're doing right now, just to make that clear, that's not what we're doing. We're doing the reverse, or the opposite of that, which is lipo of the buttocks. But if you're wanting a BBL and you want to get lipo in certain areas and have that fat transferred to your butt, the recovery time typically, I mean, your body is continuing to recover and get back to normal, but typically you can return to work within a week. Most of our patients are able to return within a week after their procedure. So 1 week for returning to work. And no, there aren't any necessarily, there's no side effects if you go to a qualified surgeon. For the most of the time, people have complications whenever they're going to someone who's not qualified to do the procedure or who doesn't do the necessary follow-up appointments and monitoring the patient afterwards. So that's normally where the complications or issues arise. But there aren't any side effects. I mean, if you're getting fat from one area of your body and placing it in another area, I mean, it's the fat that was already in your body. So your costs would definitely range. There's no exact price. You would have to have a consultation in order to receive an accurate quote. But here at Georgia Plastic, it can range anywhere from $10,000 to $15,000, and that depends on how many areas of liposuction you're receiving, how big you are, whether you're wanting to combine different things. Those sort of things go into that cost. But it is an all-inclusive price. It includes things like your garments, your follow-up appointments, your post-op care, all of the things that you need in order to ensure you have an amazing surgery. So actually, this is a male patient, and yes, he did previously have a Brazilian butt lift, but they added a little bit too much fat or more fat than he would have liked, so he's having it reversed right now. Yeah, it's okay. No, it's understandable. So, you know, for those of you men out there who are interested in getting a BBL, it's not just for women. You can do it on a man too. Hey, how are you? Hello, all the Haitians out there. So this patient is under anesthesia. We have an anesthesiologist that's watching the patient and making sure everything is going well, monitoring their vital signs. We have an entire staff here to support that patient. I'm not exactly sure how many cc's he received the first time, but I mean, he wasn't happy with his results, so. According to Dr. Okoro, one of the big differences between doing a BBL on a female patient and a male patient is the amount of fat that you're putting in and the hip area. Someone said, is it biblical to do this?
Pretty easy for me.
No, he said biblical.
Biblical. Yes. God made you from me to do this. Absolutely. If God didn't want me to do it, I wouldn't be doing it. Trust me.
No, he will not be taking the skin out. So actually, after he's done doing lipo, if you look over here at that machine, we're going to use that machine to tighten the skin. That's going to use radio frequency heat to tighten that skin and help it snatch right back. That's a skin protector. It's a skin protector just to make sure that there's not too much friction and that the patient isn't left with any scars. Yeah, let's get closer. There's a lot of people on here asking a lot of stuff. People speaking in other languages, and so they
Never
want to
been
know.
seen before on the internet. Butt reduction.
Male butt reduction.
So, we want to move on from top.
I don't want to be too tall though, because I don't want anything to fall.
Okay, so we have reduced the right buttock. Haven't done. Can you see the difference?
Yeah.
The
See
right
how much
one, the
bigger?
left one hasn't been done yet. You can see that right one is
You
done,
kind of see.
and the left is not done. There's a male butt, that's a female butt. Can you see the difference?
Yes.
Male and female butt, that's a big difference.
This is a
Male
butt reduction.
female butt.
There you go. Thank you.
You're welcome. I'm not done. I'm still working on it.
He's still sucking though.
Yeah, I'm still talking.
Yeah, see, there was a lot of projection. That's exactly right. There's a lot of projection. And since this patient is a male, he doesn't want, you know, such a protruding butt. And even some females don't want something so big, you know? You want something that's natural, that looks just real and proportional. Here at Georgia Plastic, our surgeons work hard to make sure that you still look professional and you're still comfortable with your appearance. We don't make really big, you know, don't think that you're gonna come in and get like a Kim Kardashian or Black China type of butt. We want it to be proportional to your body. Oh, great question. We want your butt to be proportional to your body. So he's just trying to reduce some of that, particularly in the hip area. The hips are great for women, but for a male BBL, we don't want too much hips. It makes it look too curvy, too feminine. Yes, it's a man, not a woman. Yeah, I mean, the patient is under, you will never see our patient's face, but the patient is under anesthesia. So, I mean, while of course this would be painful if somebody was awake, it's not painful. He's not feeling anything. Of course, he'll be in some discomfort when he wakes up, but we do things to minimize that. Yeah. Maybe. Yes, may God always help us. So we'll inject some pain numbing medicine, and afterwards that's going to help manage that pain. We're located in Atlanta, Georgia. If you know where Atlanta, Georgia is, we're right there. Come see us, even if you're not in Georgia. We offer virtual consultations. We see lots of people from all around the world. Of course, before and after surgery, we highly recommend that you adopt a healthy lifestyle, that you work out, and that you eat healthy. Surgery is not a replacement for living a healthy lifestyle, and living a healthy lifestyle is not a replacement for surgery. There are certain areas that you're working out, and even if you're working out and you're eating healthy, you can't necessarily always build a butt as big as a BBL, or you can't necessarily build breasts. You can't necessarily build some of those things. So that's why we're here, to help enhance your look, enhance your life, you know? It's not a replacement. They're two different things. Some people, as much as they work out, as much as they lift weights, they can't necessarily, you know, make hips. They can't make a really, really tiny waist. So, you know, we're here to help them in that journey. Yeah, it's not for everyone, and your viewers' discretion is advised. Hey, Jamaica. Dr. Okoro, somebody's in Jamaica.
Jamaica.
A mommy makeover, you would need a consultation. It depends on what procedures that you're wanting to combine in your surgery. You can do something like a tummy tuck, so you can have the fat sucked out of your tummy and have the skin removed, and then we can flip you over and do a BBL. That is a really, really great ultimate mommy makeover. Flat tummy, big booty, what everybody wants. Oh wow, okay, yeah. I mean, definitely come see us. We understand. Of course, we want you to be living in a healthy lifestyle, like I said, and even after your surgery, you still need to be living healthy. But yeah, it's scary for some people, but there's no worries here. Yeah. Sorry guys, I'm trying to keep up with all of your comments. Sorry, what is the maximum, what? Typically it's safe to remove about 6 liters of fat. 5 liters of fat. That's normally what's safe to remove in one surgery. But you can always have around 2. You can always have around 2.
And rematch.
Yeah. So our consultation, that's a great question. Oh, somebody's watching from Zimbabwe.
Zimbabwe. Wow. Zimbabwe. I think they beat everybody now.
Yeah. Oh, someone else from Jamaica.
From where?
Jamaica.
Jamaica. Okay. Jamaica is just down the street. Y'all.
I know, right?
Zimbabwe. I got respect for you.
Are you really in Zimbabwe?
Yeah. People all over the world.
I'm sorry, I can't keep up. There's a lot of questions, so if you just asked a question, there's been a flood, so I'm not sure if I've answered all of them. Hello from Liberia.
Liberia? Oh my
Yeah.
God.
Oh wait, someone said Somalia.
Somalia? Are you serious? Somalia?
I don't know if you guys are for real, if you guys are just...
No, I think that's for real. People don't lie about
Yes, actually, this patient had a male BBL, and if you look at our page, you can scroll down and see that we have done a lot of male BBLs. But this patient kind of went to someone else, so they put too much fat in there. There's a lot of projection, so we're here to help that by doing a butt reduction. Hey, Jamaica. A lot of Jamaica. Yeah, so our consultations, it depends on who you want to see. Oh, hi from Holland.
Where?
Holland.
Okay.
Oh, someone else from Somalia. For the question about the consultation fee, if you want to see Dr. Okoro or Dr. Park, that would be $100, and that cost does go towards your surgery, your procedure, whatever procedure you choose to do. You can also see our physician assistant, Scarlett, and she's $50. And you can see any of these people virtually as well. You can, if you're far away or you can't make it into the office, you can schedule a virtual consultation through Skype. Just give us a call to schedule that. A lot of Somalia, people, Somalia, someone else from Haiti. Oh, another Jamaican. Oh, someone said, yeah, for real, someone shared this page into the Jamaican group. Oh, someone from Jordan.
Jordan? I don't like Nigeria stuff.
Somali. Whoa.
Fuck Nigeria. They didn't even have to say anything.
What about Russia?
How about Russia?
Is Holland close to Russia? Hi, from Boston.
From Boston?
Yeah,
Like down the street, Boston?
I know. Boston is close to us.
Hi, Boston.
Thank you for sharing. Thank you for sharing. Yes, it is good. Hey, from Kenya.
From where?
Kenya.
Kenya, okay. I think that's one.
Oh, Switzerland.
Never been there yet, but I will.
Hi, Boston. Lots of Boston. I don't know what country that is. Hawaii. Have you guys heard of this country? Hawaii.
What?
Hawaii. I don't know. Oh, from San Jose, California. That's close. Minnesota. Hey, Minnesota. One of our nurses is from Minnesota. She loves Minnesota.
This is good right there. I thought that.
We're in Georgia. We're in our surgery center in Georgia. Hey, Turks and Caicos. I'm sure it's so beautiful over there. I want to be in Turks and Caicos right now. Hey, Australia. I think your quote is good for like a month or two, but if you're working with your patient coordinator and you like let them know, hey, I'm ready to book my surgery, I just need a little bit of time to either pay things off or whatever, then they can assist you with that, you know. But if you get a quote and you just walk out of our office and don't say anything, yes.
Come and do it before and after the doctor said we can do a video before.
Okay. So let's get closer, guys. Let's go.
Come back here.
To the back?
Yeah, come here.
Okay, so let's go over here, guys. So this is happening in our surgery center in Atlanta, Georgia. A suture surgery center.
Georgia.
the most advanced surgery center in Georgia
For plastic surgery.
for plastic surgery. Get that right. Don't come over here for other things.
Yeah, don't come here to have your baby, okay? We
So
don't
look
have
at
a
that,
baby down
guys.
here.
So this is the left side is the before and the right is the after. So this is a butt reduction. This is a male patient who previously had a, if I get too close then I see. So that's the before and that's the after.
Yeah, I'm gonna go over there. I'm gonna be over there at some point.
Okay, so I'm gonna move.
You're gonna be right over there. So let me start. Let me switch.
That's our surgical tech charisma, guys. Say hi. So we're gonna switch positions. I'm gonna place you guys over here. We also have an anesthesiologist. She's behind this blue curtain over here, monitoring the patient.
Wow. Wow. I need to take this down. It's a big difference. Being from here is just different. You just
Yes,
from here, right?
yeah.
It's a big difference.
You already tell which part is the before and which part is the after. Sorry guys, there's over 1,000 people watching right now. I can't keep up with all of these comments, so I apologize if I have missed. I'm in a good one.
How do you want to respond to all these comments?
I know that's what I'm telling you. I'm sorry if you have a question and I missed it. Please ask it again. I'm trying to answer everything.
So we got the numbers? Yes, you have it.
So in case you're just joining us, we are in the process of a buttocks reduction. This is a reverse Brazilian butt lift, or the opposite of a BBL, or reducing a patient who previously had a Brazilian butt lift, a male patient who got a little bit too much fat, a little bit too much curve, and wants a more masculine appearance. So that's what we're doing today. This is a male butt reduction. A male butt reduction by Dr. Stanley Okoro, double board certified plastic surgeon. Yes, we are in the USA. We're located in Atlanta, Georgia. If you know where Atlanta, Georgia is, we're right down the road. Get on 20, get on 85, get on whatever, you can get to us. But we are in the USA. We follow all the FDA regulations, American Board of Plastic Surgery's regulations. We follow all of those rules and laws. Well, yeah, we do Brazilian butt lift too. If you scroll down, if you visit our page, Georgia Plastic, and you scroll down a little bit, you'll see earlier this morning we did a Brazilian butt lift where we did lipo on a patient's abdomen, her waist, and snatched her waist and put the fat into her butt. You can also check out Dr. Okoro's book. It's available on Amazon. You can get a digital copy for your Kindle. You can also purchase a hard copy. It's called Everything That You Need to Know About Plastic Surgery, about a Brazilian Butt Lift, on Amazon. You can also just type in Dr. Okoro, Dr. Okoro, and then the book will come up. It's the only book on Amazon about the Brazilian butt lift, and it provides all the information that you need. Even if you're not trying to be a patient at Georgia Plastics, it's really great for you to have information on the procedure that you want, and also just, you know, learning more about plastic surgery before you get it. So, and all of the proceeds from the book do benefit Georgia Plastic Foundation, and that foundation benefits Dr. Okoro's medical missions internationally. So So Dr. Okoro does go around the world and save people and do life-changing surgery. So if you buy that book, you're helping that. Yes, the patient knows. We are a highly qualified and premier plastic surgery center in Atlanta. So of course we would never do anything that's illegal or breaking any sort of laws. We do get all of our patients' consent before we go live, before we record and post their pictures. So all of our patients are very much aware that we are recording them and, you know, they're comfortable with it.
We don't show their name or their face.
That's right. We do not show their name or their face, and we also protect their privacy. Absolutely. Please let me know if you have any questions about the recovery process, the post-op process. We're definitely here to answer as many questions as you can. We go live for educational purposes. We want to teach you guys and make sure that, you know, you're making the right informed decisions before you choose to have plastic surgery. Plastic surgery can be very beneficial and really enhance your life. Enhance your look, enhance your life. That's our motto. As long as you do it safely. So now Dr. Okoro is working on the other cheek. He's working on the other butt cheek. We'll be on the news for something great. Yeah, we've been on the news for Dr. Okoro's medical missions in Nigeria. We've been on the news, Dr. Okoro discussing safe methods of the Brazilian butt lift. And so you can check us out, actually, Google us. We are on the news for great things that we do. I see so many different... No, we won't, but we appreciate your concern. Dr. Okoro, I can type it out for you. No, you won't have any side effects if you visit a qualified plastic surgeon. You shouldn't be worried about that. This is just called a butt reduction. We're reducing the volume of the buttocks. It depends on how much fat you have. If you're wanting a fat transfer, we can do it. Yes, we do. We do hair transplant. We do smart graft. We have PRP. Definitely message us if you're interested in doing hair restoration or hair loss. We can do that on men, on women. If you have a beard you want to grow, any of those areas, we can help you with that. But even if you're a smaller person and you want to do a fat transfer, we can do an implant, a butt implant, which is very safe. And there's other options. You can find fat in unlikely areas and still get you a good BBL. Dr. Okoro is working really hard right now, sucking out all of that fat. Yeah, if you have hair loss, we can help you. No, this isn't Kim Kardashian. Yes, this is a human. Someone said, is this a human or an example? If you're interested in doing this procedure and you're Spanish speaking, you can give us a call. We have a Spanish speaking nurse here that can assist you. Yes, it's a human. No, as long as you go to a qualified plastic surgeon, then you shouldn't experience any, side effects or anything bad. And even if something does occur, they can help you and take care of it accordingly. You can just give us a call or shoot us an email. I can type in the phone number right now. And we do virtual consultations, and we also do in-person consultations. If you're in Georgia or in the Atlanta area, just come down and see us. But if you're in another area, then you can do a virtual consultation with Dr. Okoro, Dr. Park, or our physician assistant Scarlett. That's our phone number. I'll pin that. Yes, he is sleeping. He's under anesthesia. It's a man. Yeah, so we will inject a pain numbing medicine afterwards. That's going to help with the pain management. Of course, this patient, it is a surgery, he is going to be in some discomfort, but we will do things to manage that pain. And after he gets over the first couple of days, he's going to be fine. Most patients are able to return to work within 1 week after having a BBL or lipo. So it's going to depend on what type of tummy tuck is right for you. We offer a lot of different types of tummy tucks. We do a mini tuck if you're just having a little excess skin like on the lower part of your abdomen or upper pubic area. You can do a mini tuck, you can do a standard tuck, but it depends. And if you're adding lipo, how much lipo, all of those things. Yeah, the only thing we're destroying is the fat, okay? And that's what we want to take off. I'm sorry if you're asked, there's a lot of people on right now, so if you're asking a question and I can't keep up with it, please just ask it again. We're located in Georgia. If you know where Atlanta, Georgia is, you can find us. Yes, this is liposuction, you're right. So yeah, if you are 204, it really depends on your BMI, but we try to make sure that your BMI, which is your body mass index, is below 40 in order for you to be a candidate for surgery. The reason why we have that regulation is just to make sure that you're healthy enough and having, you know, cosmetic surgery is a good option for you. We want to make sure everything is safe and you have the best possible chances of having an amazing result. So you will probably need to lose a little bit of weight. We have a wellness center here though. Real Wellness is located here in Georgia Plastic in our building. So you can visit with them and find out some options on how you can manage your weight and then become a candidate for plastic surgery. So no, it's not necessarily the same anesthesia that you would get at a C-section. This person is completely asleep, like they're sleeping. So not feeling nothing or anything. This is pretty much just liposuction of the buttocks, you could say that. A butt reduction. Yes, we did have permission. We have consent forms and things like that that we go through with our patient before we ever go live with them. And we also, you know, they know that we're going live, they're comfortable with that. I mean, of course, if you don't go to somebody who is a good plastic surgeon, then you run the risk of things like, you know, I don't know, like a blood clot, blood loss, or something like that. But you shouldn't have to worry about that as long as you're making an informed decision when choosing your surgeon. You can go to the American Board of Plastic Surgery's website and type in any doctor's name and see, you know, if that person is good, if that person has any issues or anything like that. So just go online and do your research, guys. So if you have high blood pressure, but it's managed, it has to be managed. If you're taking your medication and you're seeing your doctor and everything is under control, yeah, you can still have surgery. But if your, you know, blood pressure is really high regularly and you're not seeing your doctor, then no, you wouldn't be a candidate. We'll have to take care of that before we have surgery. We want to minimize the risk of any sort of complications or discomfort or anything like that. We want to set you up for success. It's unfortunate I don't speak Arabic.
What?
I said it's unfortunate I don't speak Arabic.
Oh, okay. It's Arabic, okay. Google Translate.
Too many messages.
Then Google Translate. Oh.
Yeah. Okay, Dr. Okoro, one of our viewers said that they were wondering if this is the same type of anesthesia they received during a C-section, and they said that that anesthesia made them itch. If that's...
It could be from allergic reaction to one of the medications, but there's different kinds of anesthesia. We're using today's general anesthesia for the patient.
Right.
This patient went to another plastic surgery for blood reduction, and they couldn't do it, so this is the third time. And the first time to us was this third time. I think we got it done. Done. Up there. You hear me, though?
Yes, it is. Hey, thanks for translating.
Huh? Almost 15? When did we stop? 1. Okay. That's good.
Thanks for translating that. It's really cool that you can speak Arabic too. So are you wanting to know about like lipo or BBL? It really depends on how much fat. If you're wanting fat injected into your butt and like having lipo and then having that transferred into your butt, it would depend on how big you are and how many areas. I mean, most of the time Dr. Okoro can get it done in like what, 4 or 5 hours.
We did one this morning.
Yeah, we did one this morning. So it depends. But you can kind of use that range from 4 to 6 hours typically. A tummy tuck, it would depend on what type of tummy tuck you're wanting, but that ranges anywhere from $8,500 to $15,000 $1,000 and then upwards even after that, depending on how much lipo you need and what type of tummy tuck. Please feel free to visit our website, georgiaplastic.com. I'll go ahead and type it out for you. And you can see all of the price ranges for different procedures and learn more about our office, our surgery center, and our doctors. No, this is not a dead body. This is a human. He's alive. Wow. Guys. Our website is georgiaplastic.com. I just typed that out for you. So what he's doing right now is a butt reduction. He's doing liposuction on the buttocks of a patient who previously had a Brazilian butt lift. I mean, yes, it is a surgery, so there are, some discomfort, of course, but we do things to manage that pain, like using Exparel and giving the patient, their proper medications afterwards. So please feel free to ask your question again if I don't answer it. Well, I mean, he uses different things at the beginning to make sure that there's not going to be a lot of blood loss. That's not good. For dark circles, well, maybe we can do some injectables or something like that on your face if you have dark circles. Maybe something at our spa. We do have a medical spa here, a Machi Med Spa. I'll type that out for you too. And they offer like a VI peel and some other non-invasive procedures also. A Machi Med Spa. Yes, we do take care credit. We take various different types of credit cards, PayPal, care credit, Alpheon, and our patient coordinators can assist you with applying for that and getting that to pay for your surgery. If you're somebody who wants like a breast reduction or you have a procedure that's medically necessary, we do accept various forms of insurance, and you can use your insurance also. We have a very amazing insurance coordinator here that can assist you through that process. Unfortunately, insurance isn't going to cover your BBL, but if only. Hey, thanks for joining us. Yes, this is real. Yeah, we understand that this isn't comfortable for everyone to watch, so viewer discretion is advised. If you're not comfortable seeing this type of things, please, understand. We understand. You can just log off. We're doing a butt reduction, so liposuction on a patient's buttocks. Yeah, we understand that plastic surgery and cosmetic surgery really isn't for everyone, but we get that. We offer non-invasive procedures, and if it's not for you, that's okay. We have plenty of people who do. who do need it and who do want it. Yeah, we have a lot of different staff members who are well versed in various languages, so if you are speaking a different language and you want to give us a call or shoot us an email, we can try to assist you. Well, Dr. Okoro is actually originally from Nigeria. He's originally from Nigeria, so shout out to all the Nigerians out there. Hey. How long have you been in the U.S., Dr. Okoro?
30 years.
30 years. Nigerian American, been here for 30 years.
Now I just gave up my age. I guess I came here when I was 1. Not. You can't give my age. Don't do it.
Are you sure?
No.
It would be fun.
I'm not even going to dignify that.
We're going to say 25.
There you go.
Please be respectful of our other viewers and be respectful of our patient. You know, please no foul language or disrespectful or degrading comments. We don't tolerate that type of behavior. And we want to make this a fun and educational space for people to watch plastic surgery and learn more, and no negativity.
Yeah, please respect this patient gave us consent
Yes,
for us to use his surgery to educate people.
that's right.
It's not meant for anything other than that. Okay, it's just sort of informational session. Okay.
That's right.
Okay, so let's respect the patient's dignity.
Exactly.
You don't like it, don't watch.
Yeah, we understand this type of procedure isn't comfortable for everyone, and just please log off and, you know, keep scrolling.
Yeah, this is what I noticed that.
Well, yeah, his mama and papa sent him here to be a successful man and a successful surgeon, and that's exactly what he's doing. Dr. Okoro is not just a plastic surgeon, but he's a general surgeon also, and he worked as a general surgeon before he was a plastic surgeon, and he still uses those skills whenever he does his medical missions internationally. So he goes around and he does life-changing surgeries that for people who can't afford it, who don't even have access to medical care. So we thank Dr. Okoro for his service and the things that he does for his community. Yeah. Yeah. So the part 2, or the second aspect of this procedure, is Dr. Okoro is going to use ThermiTight, which is a very, very high-tech and medically advanced tool. Not every doctor has this, and it uses radio frequency heat to tighten skin and melt fat, and it really helps just tighten that loose skin and snatch you. No, you can't see the face of the patient, unfortunately. Sorry. That's against, they want to see the face of the patient.
That's why it's called privacy.
Yeah, I mean, we always encourage all of our patients that, we always, you know, make sure our patients are comfortable with themselves and are happy, you know, with their bodies and everything, even before they come in. We just want to enhance your look. We're never saying that you're, you know, you don't look good or you're not happy or anything like that. We want to enhance you. Because everyone is beautiful in their own way. No, we're not putting silicone or air into this patient's butt. This patient had a legal Brazilian butt lift, which is a fat transfer after doing lipo. They remove fat from unwanted areas and they inject that into the butt. So that patient previously had this, but we're just sucking some of that out right now to create a more masculine appearance.
Almost 17. Almost 17.
17? 17? Okay.
Yes, this is a real person. This is a real patient. Yeah, I'm not sure what sort of procedures the Kardashians have had or anything like that. I'm not sure. You should ask them. You working hard, Dr. Okoro. No, not necessarily. It's very legal. It's very good. Many doctors have practiced this and been doing this on patients for years. And they also have, have a lot of regulations with the American Board of Plastic Surgery. The FDA have really put in place a lot of regulations to make sure that it's safe. Most of the horror stories or the bad stories that you hear are people who did not go to a real plastic surgeon and people who did not follow post-op care. Post-op instructions. We are sharing this to inform patients and to educate people on plastic surgery and the various procedures that they can receive, to make sure that they're making, informed decisions whenever they're choosing to have elective surgery. Charisma. Yes, the patient does know. All of our patients, of course, are informed of this and they sign consent forms. We do have their consent to record their procedure, and we don't show their face or their name or any of their details or anything like that. We don't show any of that. No. Once again, we do get consent forms from the patient. We have consent from that patient before we go live. So liposuction is a technique that reduces fat and removes fat from unwanted areas. Yeah, I know you want to stop watching, but you can't. It's addicting. Join us again. No, actually this is a butt reduction, so we are removing fat from this patient's butt. No, we can't tell you that information. Yeah, so if you saw kind of before, his butt was a little bit, just had a lot of projection on there. And typically that's not this type of BBL we would do on a man. Now he had a BBL somewhere else. So that doctor kind of gave him a little bit more of a feminine appearance, more hips, a larger butt, and he wants a more masculine appearance. So A man can want a bigger butt, but most of the time they don't want a female butt, they want something more masculine. Yeah, we do. We'll post the before and after photos. A tummy tuck would depend on what type of tummy tuck you would want to do. We do a mini tuck, we do a standard tummy tuck, a fleur-de-lis. We offer a lot of different types of tummy tucks, so you can kind of if you scroll down on our page or visit our YouTube channel, Georgia Plastic, you can see where we've done tummy tucks, or we've done lipo on the abdomen. So those are kind of tummy reductions. Yeah, like lipo-abdominoplasty. Just visit our YouTube channel, Georgia Plastic, and you can see all of our live surgeries there. Or if you want to stay on Facebook and just scroll through our Facebook, you'll see some other live procedures.
I was done with liposuction now. I want to tighten the skin of the butt. I call it Thermi butt.
Right.
This is Thermi technology. Hey, media, content.
So up next, Dr. Okoro is going to use a really amazing technology that uses radio frequency heat to tighten the skin. The patient previously had a Brazilian butt lift, and the butt was a little bit bigger than they would have wanted, so they're wanting a reduction, a more masculine appearance. That's why they're doing it.
You go up to 65. And then the footbed was probably too short for this. So, give it on Grace's foot. Like that. Alright, hit it. So step on it. Okay, there you go. So, actually, this would be a cool thing for you to watch, actually. Because you know my come over here, so you can show them how we tighten the skin like that.
What about the foot pedal?
Just leave it there.
This is actually going to be a bad angle.
No, you gotta come from behind me.
We won't be able to see you.
Okay. Can you see the monitor though?
Let me just readjust.
Maybe just a quick view of the monitor.
I'll readjust this. Yeah, so we have an anesthesiologist, we have a nurse, we have a surgical tech, we got a lot of people in here. And they're to support the patient.
Patient safety.
Patient safety first. No, he's sleeping. Yeah, a Brazilian butt lift is on average about 4 to 6 hours depending on how much fat they have. Now, if you're just wanting plain lipo, depends on how many area and how much fat you have, but can range from a couple hours. Like this one is going to be what, only a few hours, a couple hours. Yes, the patient, we did have consent from the patient to record.
Hi, Seb.
Hi, Sebs. It's one of our other surgical techs. She makes sure all of the instruments are clean and properly cared for. Our surgical techs are so amazing. Here at Georgia Plastic, we have no infections, none of those types of problems because of our amazing techs and the excellent care that they take. We're located in Georgia. If you know where Atlanta, Georgia is, you can find us. Yeah, so the patient will be in some discomfort afterwards, but we'll do different things to manage that pain. We use X-Rails, a pain numbing medicine. You'll see Dr. Okoro inject. You know, of course, we give them the proper meds to help with the pain management and all of that.
I'm done about 2-3 minutes, okay?
So if you're looking at the screen right now, this is ThermiTight. This uses radio frequency energy to tighten skin. Dr. Okoro and Georgia Plastic is the center of excellence for Thermi in the Southeast region. So he's an expert with Thermi. He's been working with Thermi for many, many years. He has a lot of tools, a lot of amazing technology in the medical aesthetics. He's very well versed in using technology for medical aesthetics. So he's just using that to tighten the skin on the buttocks so that once this patient is healed up, their skin is going to snap right back.
In about 1 minute, we're going to represent the camera to the other part.
Okay.
That's all. 1 minute. Exactly 1 minute. Exactly 1 minute.
Alright.
So somebody, come on, man.
Oh.
So if somebody has cancer, they need to, you know, control that and take care of that first before, you know, thinking about cosmetic surgery. So I highly doubt someone who's battling cancer, and shout out to all of our cancer survivors. We see a lot of cancer survivors here at Georgia Plastic, a lot of women who've had breast cancer come in for reconstructive surgery and that type of thing. But if somebody, you know, is battling cancer, I highly doubt that, you know, a BBL or something is on their radar for concern. Oh no, that's the monitor. So like if you look at the machine right there, gradually going up and sometimes going down too, depending on how much heat he's applying, and that's the noise. See, now that he's walked away, it stopped because he's the one controlling that. It's this machine that's making that noise.
So that's a
It depends on what area. It depends on like your own skin elasticity. So for some people they might need another one, or they might need another treatment. For other people, you know, they're good after one. Of course, gravity, you know, as you age, your skin is going to fall anyway. So sometimes you might want another round in 10, 15 years, but we can't stop the aging process. We can just try to make it as easy as possible. So this person should be able to return to work within about a week. Yeah, so the patient will be here and then he'll recover from his anesthesia for about an hour. All of our procedures are outpatient procedures, so after they've recovered from their anesthesia, a family member or friend comes to pick them up and takes them home. For some procedures, we see them the next day. For less invasive procedures, we see them a week later. Thank you. Thank you for joining us. Thank you for enjoying it.
Hey, Clay, can you take a picture of this butt for me? Actually, this video before you put it down. Bring your camera. I'll use my phone actually.
This is liposuction, a butt reduction.
So, position this way to see the both butt cheek here.
So now she's just repositioning the camera so that he can monitor the butt cheek he's working on and monitor the heat. So he doesn't want it to go up too high because that could potentially cause burns. So he's just monitoring that on the camera.
Yeah, just the square on the bottom here. That's good. Thank you very much.
Well, congratulations. So he's just using that probe to target the fat in different areas, or target the heat, the radio frequency heat in different area, and then he's watching the camera to make sure that it's not getting too hot and everything is going great. There's not necessarily like an exact, I mean, it's a very wide age range. Of course, you should be 18 or older, and if you're younger than 18 and you're wanting a, you know, elective procedure, then, you know, we would take that on a case-by-case basis, and you would need parental consent. And as long as you're healthy, even if you're older, we've operated on people in their 80s, so there are some options for you. Yeah, a tummy tuck, maybe some lipo and a tummy tuck, that would be really great. That really helps snatch the tummy and make everything flat.
I'm going to do extra roll for the waistline now.
You guys can see me, definitely.
So now we're going to inject extra to knock it out.
So now we are going to inject, for those of you who are concerned with the pain of having a surgery, this is one of the things that we do to really help manage that. We use Exparel. Exparel is a pain numbing medicine that time releases meds into the patient for 3 days post-op. So for the next 3 days, he's going to get a little bit of that medicine that's going to help, you know, just numb things out and help him feel better. Of course, you know, this is a real surgery. There are going to be some discomfort and some pain, but this just helps you get over the rough part, and the recovery process after that should be very smooth. Yeah, this procedure is done. Pretty much, you're just going to inject that Exparel, and we're finished. Please give us a call if you have any questions or you want to schedule a consultation. I'll type that out now. And you can also visit our website and check out our plastic surgery fees if you have any questions regarding the general price of things or wanted some more information on various procedures. GeorgiaPlastic.com. Once again, you are watching a live procedure from Georgia Plastic and Reconstructive Surgery located in Marietta, Georgia. We're right outside of Atlanta. If you know where Atlanta, Georgia is, we're just a skip and a hop away. And the surgeon performing this procedure is Dr. Stanley Okoro. He's a double board certified plastic surgeon with over 20 years of experience. So if any of you guys are interested in scheduling a consultation with Dr. Okoro, we also have another amazing plastic surgeon, Dr. Daniel Park. You can schedule a consult with him as well. And as well as our physician assistant, Scarlett, according to Scarlett. So I guess we will hop off now. Once again, thank you so much for joining us. Live at Georgia Plastic, please.
Enhance your look, enjoy your life. Georgia Plastic.